Sorella, base BELL1. This is my final exam in speech and oral. World Health Organization Director General opening remarks at the media briefing on COVID-19 on March 11, 2020. The coronavirus pandemic hit the world where it least expected and brought about many changes to our daily lives. As a way to curb the spread of the coronavirus, many governments imposed virus guidelines to their citizens. Among them being physical distancing and the ban on the mass gatherings. The first human cases of COVID-19, the disease caused by the novel coronavirus causing COVID-19, subsequently named SARS-CoV-2, were first reported by officials in Wuhan City, China in December 2019. Retrospective investigation by the Chinese authorities have identified human cases with onset of symptoms. In early December 2019, while some of the earliest known cases had linked to a wholesome food market in Wuhan, some did not. Many of the initial patients were either in-stall owners, market employers, on regular visitors to this market. Environmental examples taken from this market in December 2019 tested positive for SARS-CoV-2, further suggesting that the market in Wuhan City was the source of the outbreak or played a role in the initial amplification of the outbreak. SARS-CoV-2 was identified in early January and its genetic sequence shared publicity on 11-12 January. In the past 2 weeks, the number of the cases of COVID-19 outside China has increased 13-fold. The number of affected countries has tripled. There are now more than 118,000 cases in 114 countries. And 4,291 people lost their lives. Thousands more are fighting for their lives in the hospitals. In the days, the weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. World Health Organization has been assessing this outbreak around the clock, and we are deeply concerned both by the alarming levels of spread and security, and by the alarming levels of inaction. We can avoid this virus if we follow the rule like washing your hands, wearing your face mask, and alcohol to disinfect. As of now, many researchers have been able to look at the heroic features of COVID-19, and the results from these studies are essential to preventing further zoonosis introduction of COVID-19 into the human population. The World Health Organization continues to collaborate with animal health experts, member states, and other partners to identify gaps and research priorities for the control of COVID-19, including the eventual identification of the source of the coronavirus in China.